Hello everyone, today I'm going to perform the technique of setting up a catheterization tray and a simple technique of insertion on a female patient. So before I do anything else, I will perform the hand hygiene and make sure the privacy of the patient, and I will also check the two identifiers to make sure it's the right patient. And then I will confirm the order and explain to the patient the purpose of this procedure, which is to drain the urine from her bladder. And also I will raise her bed to a comfortable height and make sure there's a waterproof pad underneath her. And then I will help her into a dorsal recumbent position and tell her to relax her thighs. And then I will apply the clean gloves and then clean the patient's perineum with soap and water. And after that, I will discard the clean gloves and then perform the hand hygiene again. So right after that, I will open the catheterization tray and I will take out the drape, okay? And make sure it's shiny side down, and I will put the drape underneath her hip and between her thighs, okay? And during this process, I will make sure I do not touch anything that is a steroid. And then I will put on the sterile gloves, and I will lubricate the catheter. I will insert the catheter 2.5 to 5 centimeters into the lubricant. Okay, that's for the female patient. And then after that, I will cleanse the patient's urethral meatus with sterile cotton balls. Okay, and first I will separate the labial with the fingers of my non-dominant hand. In order to avoid the contamination, I will pick up the forceps, holding one cotton ball at a time, and then clean from the clitoris towards the anus, beginning with far labial folds and then move to the near labial folds, and then work directly over the center of the urethral meatus. Okay, and after that, I will pick up the catheter, the 7.5 to 10 centimeters length, this one, the catheter, from the tip, and make sure the urine tray is positioned. Okay, and I will advance the catheter 5 to 7.5 centimeters into the patient, and then release the labial. Okay, but at the same time, I will make sure I hold the catheter securely with my non-dominant hand. So the urine is gonna go from the catheter into the tray. Yeah, so that's the entire process.